Welcome back to our final video of Chapter 6. This is Section 6.4, where we'll be talking about skin disorders. We're going to talk about the three most common types of skin cancer and also the three classes of burns and how we treat burns. Skin cancer is generally caused by damage to skin cell DNA caused by UV light. So the places that are most exposed to lights are the places that are most likely to see skin cancer development. So we're talking about the head, the neck, and the hands. Those are places that are generally exposed when we're outside, no matter what we're wearing. People who have fair skin who don't have added protection from the melanin pigment that we've talked about earlier in Chapter 6, and elderly people who have been in the sun a lot cumulatively over their life are more likely to develop skin cancer. Oftentimes, skin cancer can be treated very easy. It is one of the most common types of cancers. The good news is it does have a high survival rate, but it needs to be detected and treated early in order for that survival rate to be beneficial. There are three general types of skin cancer that we see fairly commonly, and they're named for the cells of the epidermis where the cancer originates. So we have basal cell carcinoma, squamous cell carcinoma, and malignant melanoma. So, starting with basal cell carcinoma. This is the most common type. It's also, fortunately, the least dangerous type. It very rarely metastasizes, meaning it very rarely has pieces of the cancerous tumor break off and travel to other parts of the body and develop tumors there. That's what metastasize means. It forms from the stratum basale. When we see this, it looks like a small bump. Sometimes it's shiny in appearance, and it has a depression in the middle and maybe some roughness around the edges. Our next type of skin cancer is called squamous cell carcinoma. So this comes from the keratinocytes, and specifically from the stratum spinosum, those spiny-shaped cells. We see this in places with lots of sun exposure. The scalp, if you part your hair along that part in your hair after years and years of sun exposure, we can see these lesions there. On the ears, the lower lip, the backs of the hands, places with small amounts of sun exposure nearly every day is where this tends to develop. So what we see in this type of cancer is a red, raised up, scaly type ulcer. It'll have a dip in the middle, a concave center. Again, fortunately, this has a very high survival rate when we detect it early and when it's removed with surgery. If it does spread, it tends to spread to the lymph nodes, and then it is much more difficult to treat and may be lethal at that time. And finally, we have malignant melanoma. Okay, so only 5% of skin cancers are this type, but this is the most deadly type. It comes from the melanocytes, the melanin-producing cells. If it's caught early, before it metastasizes, before it spreads, it does have a high successful treatment rate. The things that lead to more likely occurrence of melanoma are if other people in your family, your parents, brothers, sisters, grandparents, aunts, uncles, if they have instances of melanoma. It's also higher in men. People with red hair are more likely to develop melanoma. And also people who had severe sunburn when they were a child. So this is one reason we want to be extra careful with little kids, making sure they're using sunscreen often when they're playing outside. Okay, moving on to burns. burns are actually a high cause of accidental death. When we think of burns, a lot of times we think of house fires, and definitely people get burned in house fires, but there are other ways that we can also encounter instances of burns. Okay, so kitchen spills, either boiling water or even worse, boiling oil, if that gets spilled on a person. Sunlight, sunburns have the potential to be more severe than sometimes we give them credit for. Exposure to radiation, acid and base burns fall in this category, those chemical burns, and also electrical shock. When someone dies from a burn, it can be because of fluid loss, it can be related to infection, or the burned dead tissue that forms as the burn is healing, we call that eschar, it can have toxic effects as well. So in order to combat that we do a process called debridement, where we remove the eschar. It's a very painful process, but critical in healing burns. So we have 3 categories of burns. I'm sure you guys have heard this: first degree, second degree, and third degree burns. So first degree burns are things that heal very quickly. Often they have little to no scarring. They only involve the epidermis, and we'll see redness, pain, and some minor swelling, slight edema. Second degree burns, of course, are more serious. We call these partial thickness burns. They involve the epidermis and also part of the dermis. Okay, so instead of being just red, they could have white or tan portions, and they're likely to form a blister, and of course they'll be painful. Second degree burns take at least 2 weeks and sometimes several months to heal, and they generally leave scars. Third degree burns, we also call these full thickness burns. They involve all of the epidermis, all of the dermis, and sometimes even tissues deeper, adipose or muscle tissues deeper than that. Oftentimes, third degree burns require skin grafts, and a person who has third degree burns is going to need support in fluid replacement, infection control, nutritional supplements to recover from that situation. Okay, so we have a picture here. This looks like a person with a severe sunburn. This is involving only the epidermis. The damage is only in the epidermis. Then this looks like one of those kitchen burns. It looks like this poor child maybe pulled down a pot of boiling water off of a stove or something like that. This is involving the full thickness of the epidermis and part of the dermis. And then our third degree burn here involves all of the epidermis, all of the dermis, and extends into the tissues below. So just a quick note about tanning and sunburns and sunscreen. So we have 2 types of UV radiation. We call them UVA and UVB. We call them tanning rays, burning rays. They both contribute to skin cancer. That we might hate to admit it, but that is the truth. Exposure to UV radiation contributes to incidence of skin cancer. And we might hate this fact too, but it is also a fact. There's no such thing as a healthy tan. If you are tan, it is because you were exposed to UVA and UVB rays, and that is increased risk of skin cancer. Sunscreens prevent sunburn, and there's some evidence that preventing sunburn prevents skin cancer. There's also some evidence that sunscreens aren't as great at preventing cancer as we once thought. It's especially dangerous when we get super high SPF, SPF 50, SPF 75 from CVS or Walmart, wherever we're buying sunscreen. And we feel like we have great protection from sunburn and skin cancer. High SPF does not necessarily correlate to zero cancer risk, and that's something that we need to pay attention to. There's also some evidence that the chemicals in sunscreens themselves have the ability to damage DNA and cause free radicals, which can harm cell function. If a person does get third-degree burns, a lot of times those burns require what we call skin grafts. So skin grafts are replacing the damaged skin with healthy skin. And we have several different options for this. We can do an autograft where skin is taken from a different part of the person's body and kind of laid over the damaged area. We have isografts. Those would come from an identical twin. Obviously, a very small portion of the population would have this option. And we also have temporary grafts, and they're temporary because we need to be very aware of the possibility that the patient's immune system would reject the graft. Okay, so a homograft would come from an unrelated person, and a xenograft comes from a different species. Pigs are used fairly frequently in skin grafts, actually. We can also use amnion grafts that comes from afterbirth, or we have some more recent developments using skin grafts containing silicone and collagen as an artificial skin can be useful in helping skin heal without causing immune system rejections.